Whether you're a parent navigating myofunctional disorders or simply curious about optimizing your family's overall health, the Myohacker Podcast is your guide. Hi, I'm Karindy Ong, a speech-language pathologist, myofunctional therapist, and a mom on a mission to bring holistic health to you and your family. Together, we'll explore whole-body connections and integrative solutions. Please subscribe and leave us a 5-star review to help other families discover this important information. Visit myohackerslp.com for free resources and guides. Quick disclaimer. The content shared in this podcast is for information and entertainment purposes only. The views and opinions expressed by the host and guests do not necessarily reflect those of the podcast or its affiliates. This podcast does not provide medical, legal, or professional advice. Always consult a professional regarding your circumstances. By listening, you agree that the host and podcast are not responsible for any actions you may take based on the information provided. Now, let's dive into today's episode. Welcome, everyone, to the Myohacker Podcast. With us today is Dr. Melissa Jones. She is board certified in pediatric neurology and fellowship trained in functional psychiatry. She is also a phenomenal provider that I get to work with regularly. I love referring my patients to Dr. Jones, and I get to see the incredible outcomes that result in their life from her functional and integrative approach. So as you're listening, you might be going, wait, neurology? We're talking about a functional approach? Yes, that is specifically what we are talking about today in this conversation that is going to be focused on PANDAS, which Dr. Jones has created an incredible course for providers and parents. It's specifically for parents, but I'll tell you, as a provider, I learned a lot, and she's going to tell us about it today. So welcome, Dr. Jones. And can you tell us a little bit about PANDAS and what it is?
Yes, thanks for having me, Karindy. So exciting to work with you as always.
Yes.
Okay, so PANDAS. So the traditional topic is PANDAS. That was the original, and PANDAS stands for Pediatric Autoimmune Neuropsychiatric Disorder Associated with Strep. We've got to change the name. It's too long, but PANDAS for short. That is the original diagnosis. Is a neuropsychiatric disorder after a strep infection. So it was pretty clear. We've had post-streptococcal disorders dating back to the 1800s, movement disorders that happen after a strep infection. So that got coined maybe 25 years ago, this PANDAS, and we'll talk a little bit more about that in a second, but that has evolved over the years to now be called PANS. So we often will just say PANDAS. PANS is a little bit more broad, so it doesn't have to be strep that causes it. And PAN technically is called Pediatric Autoimmune Neuropsychiatric Syndrome. So these are all mouthful disorders.
So if someone is listening and they're like, wait, what I'm getting is that there's some type of pediatric acute instance, can you tell us a little bit about what are those diagnostic criteria that help someone get the clarity that this is PANDAS versus something else?
Yep, absolutely. And there are definitely clear criteria because we'll get into some of the controversial nature of this disorder. But basically, you have a reasonably functioning kid who gets some type of an infection and 2 to 6 weeks later have an acute change, an acute personality change, OCD and or restricted eating are the two like foundational symptoms. I've seen 3-year-olds who were suddenly obsessively making their beds with like army corners. That's not normal for a 3-year-old.
Right.
So you get this completely obsessive or restricted eating, like fear of food.
Yes.
And then it comes with all these other symptoms. These kids are anxious. They can't separate. They can't sleep at night. They start wetting the bed. They've got tics, which are quick movement disorders of like the face or the body or their voice. So you get all these other symptoms that kind of go along with it. And you kind of turn around as a parent and go, what happened? And they're little. So they're 3 or 4 or 5, maybe older, but a lot of times they're really little and everybody downplays it. Terrible 2s, the terrible 3s, they're just going through a phase. So it gets tricky.
Yeah. And I think of so many times that as someone that works with kiddos who have feeding needs, that can be what brings someone in, is they don't necessarily see the OCD as an issue. They're like, oh, well, it tends to come up and be more specific over time, but they're just really focused on something. But the feeding is what will bring them through my clinical doors, is that they are only eating this thing, and it can be kind of odd. It's not even like a sensory issue. You know, we'll see that where I don't like purees, or I don't like meat, or things that fall apart. It's like, no, it is this specific food. I will not eat anything that is this color green. It's an interesting fixation on food, on a characteristic of food, or even a smell, or I won't be in the room with food. And that can be
like a fear of food. It's really what I usually hear. They often think that it's contaminated, it's going to hurt them, something like that. That's what I hear all the time. And again, usually, like, you get picky eaters. You know, the 18-month-old becomes a picky eater
for sure.
Versus my kid was eating everything or normal, whatever. And then all of a sudden, nope. Not touching certain foods, or it has to be served in a certain way, or it has to be given by a certain person. I hear all kinds of fun stories.
Right. And as a provider that will work with people on, okay, maybe they don't have that tongue coordination and this is why they don't like these foods. It truly is. They were eating the chicken nuggets. Now they can't have them in the room. It's a distinction, and it tends to be a pretty clear cutoff of, like you said, it's within weeks. It's not over a year. It's pretty quick.
But it can take a year to figure it out that it's something other than.
For sure.
Yeah. So it can take a long time to diagnose, but if they go back, they're like, oh my gosh. I mean, I've even had teenagers go, I remember the day I changed, and nobody really put it together, but it's been going on for 5, 6, 7 years.
So let's talk about that. Why is it taking so long for providers to identify and diagnose this?
Yep. Oh yeah. So how much time you got? No.
Right.
So it is because I think so much of our medical training, we put things in boxes. So there's psychiatric, there's neurological, and we're not supposed to like mix them together. So if you have OCD, that's psychiatric. If you have anxiety, that's psychiatric. Even tics, which are a movement disorder, which is clearly neurological, oftentimes gets put into this category of tics and OCD and anxiety. That all goes together, which is true. But if it started overnight, now I'm going, oh, well, maybe it's an infection. Maybe it's PANDAS, instead of saying, okay, here's your psychiatric meds. So the training is not to think of infections or even getting into the weeds, but nutrition and vitamin deficiencies. We just are not trained to think that could cause psychiatric issues. And so you have a 4-year-old who's coming in, having a meltdown, having OCD, which is, not even, they don't even call it OCD in a 4-year-old, just odd behaviors.
Yeah, and they're like, they're just having tantrums or immature or developmentally delayed or things like that.
Yeah. And a lot of, you're not parenting right. You need to be doing this. You need to be doing that. And so they're just shuttled to the psychiatric or a play therapist or, therapy, which is great. Right. But if you are missing this underlying infection, you're not going to get better. And that, I'll speak to that with anorexia and eating disorders. I have had so many patients do rounds and rounds and rounds of eating disorder clinics. And when you really talk to them, it's not body image. It's fear of food. And they're being treated as anorexics and going through all of this feeding therapy. And then when you actually do the testing and find out they have XYZ infection and you treat that, it's like amazing. It's now all of a sudden they're eating and all of this gets better. I'm like, oh my gosh, you were in eating recovery facility for 2 years. And it's like, no, but the doctors aren't trained that way. So I feel bad. This knowledge just isn't mainstream.
So why do doctors, there is a pretty prevalent, I would say, just understanding that providers have is that this is just psych. It's all psychiatric. There is not an inflammatory response that's involved, which is crazy to me because from a background of working with adults who had brain injuries, who had encephalopathy, who had different types of inflammatory responses in the brain, we would see dramatic changes in behavior. Why would we not expect that there's going to be a similar outcome in children?
Yeah, I know. And it's very challenging, I think, because kids do have normal behavioral issues.
True. Yeah.
And there's this huge influx of psychiatric issues going on right now, which is probably has a lot to do with inflammation and our nutritional status, but it's almost become normalized to have anxiety, have depression, go get your Zoloft. I mean, how many millions of Americans are on SSRIs right now? And it's normalized, and there's no search for the root. That's almost, many doctors would consider it malpractice to search for the root instead of giving you your SSRI.
Which I want to clarify, anyone that's listening and has just gone, oh no, they're against medications and pharmacological interventions. That is not at all the case, because I mean, we will email and be like, okay, I think maybe amantadine needs to be considered in this case to get us over the hump or through something. It's not that you don't utilize those medications, but you do with the intention that we are still getting to a root cause issue here.
Yes, I love that you said that, 100%. And that's where I think I meld the Western medicine and functional medicine really well, because sometimes you need Zoloft. I am I am not anti those medications, but if you're hoping to not be on Zoloft one day, and again, you've got to have the right story, because there are plenty of people out there that have tics that have no other issue. And I mean, 10% of children at some point in their life will have tics. Very common. That's the little movement disorder that is very common with PANDAS. But that doesn't, if someone comes in with various concerns, it's not that I say, oh, okay, everybody has something neuroinflammatory going on. No, I do the testing. I'm like, let's find out. Are you the one that needs antibiotics or needs herbs, or are you the one that is more likely to benefit from something more traditional in the psychiatric world? And sometimes we need both, because sometimes you got to get out of the house and put your pants on, and you need that Zoloft to do that. And we'll treat the infection on the back end. Yeah.
Yeah. And it's so complicated. It's not an easy fix. This isn't a one and done. This is, for one thing, how you have established your practice is a relationship with these families of really talking to them, because generally, if they are seeing you, they have kind of been through the ringer. They've tried other things because they wanted to do sort of the streamlined medical approach initially, or they've tried their own detox at home. They've tried different things. Yeah. And then they have, usually by the time they see you, they've kind of tried things, and they know just doing allopathic didn't really work, and maybe just doing holistic on their own didn't. And they are able to utilize both approaches through your practice, which is so beautiful. And I think for so many people, I will just say, please go see Dr. Jones. Just give it one session, just an evaluation. And they're like, usually they're upset. They're like, why didn't I know about her sooner? And I'm like, I tried to tell you as soon as it was relevant to your life. So I love that you provide this practice. I'm just curious, why is it there are not more providers that are doing, you have foot detox, you have the Flowpresso for lymphatic drainage, you have sauna. Why are more providers not doing this?
Yeah. Well, I mean, I think there definitely is a place for, a more holistic and natural approach and detoxing, and your clinic where you, for better or worse, you got to get in 20 to 40 patients a day and, help the kids with their various routine issues, if you will. And so I'm just so blessed that I am at a facility that we can see you as a neurological or psychiatric patient. And we can also offer ways to open up your detox pathways, help you detox, help you move your lymphatics. So I just kind of went that direction with my career, thankfully there are other places around Houston that have that even without the doctor. So we got some options.
Which, just talking about the lymphatics and drainage, it does bring up a topic that is close to my heart, which is going to be the tonsils and adenoids, because because this is such an issue with our shared mutual patients. Can you talk about what you see with inflammation in the tonsils, the adenoids, also sleep disordered breathing, because you do a lot of sleep studies, and what you're seeing in that interaction with PANDAS?
Yeah. And this is a fun one because there are some PANDAS doctors out there who on day one, they're like, you got to get your tonsils out.
Wow.
I'm not necessarily a day one kind of gal, but I have a lot of patients that benefit from getting their tonsils out. And I work with some great ENTs too, who when they see how great they do after getting their tonsils out, they're like, whoa, like that was amazing. I'm like, I know. So it's just a house for gunk. And it also is a huge immune factory. It's making your T cells. It's just a factory in there, specifically in the tonsils. And so if you have chronic inflammation, if you're chronically holding on to mycoplasma or strep and some of these bugs that we know cause PANDAS, we try our best. I don't want everybody to go through surgery, but sometimes just getting them out can be a game changer so that your body isn't constantly fighting these bugs. Your body's supposed to fight these bugs. The immune system, that's what it's supposed to do. Yeah.
Right.
It's doing its best, but it's like on hyperdrive and it's too much inflammation going on.
So something that you also do, though, is when your patients, let's say they do need to go under anesthesia, they do need to get something removed, is you have already, in general, you can speak to this if this isn't true, but I see that you've tested for things like their omega-3 levels, like what their baseline is. You're actually supporting the lipids in their body so they can actually get that anesthesia out more efficiently. Can you talk to that and what that looks like a little bit?
Absolutely. Yes. I mean, I do so much nutrient, vitamin, omega testing to see what your baseline health and nutritional status is so we can supplement appropriately and not just here's 35 supplements because they sound good, which a lot of patients come to me on and they're like, here, I'm doing all of this. And I'm like, well, it's fine, but maybe we can hone it in a little bit. So I do a lot of that testing, and our brain is 2/3 fat and cholesterol. So making sure that we worry a lot about high cholesterol in America, but a lot of these kids actually have low cholesterol, but their guts are not healthy. They are having cholesterol come out in their stool. So it's actually, it's really fascinating. So we do a lot of that testing to see.
Wait, you got to bring me back. Why do they have cholesterol coming out of their stool?
Yeah, their guts are so unhealthy, they can't absorb it.
Oh my gosh.
I know.
Wow.
And they have tons of nutrient deficiencies. So I joke all the time that I double as a GI doctor.
Oh, yes, you do. You do. That's why I'm like, please go see Dr. Jones first, and then let's see what the gut is doing after you've done her protocols.
Yeah. I mean, if you're worried you have really big GI disorders, please. And I have great friends in the GI community. So yes, I mean, I work well with others. Let's make sure we're doing the right thing. But if you're just chronic bloating, stomach aches, or I do all of these testing, I'm like, all of your vitamins are low. There's no way that, you're not getting in your nutrition at all. And then we'll do gut testing. And I'm like, oh my gosh, like you're not digesting your food. You're not absorbing your food. So we got to get to the root of the gut. Gut health is huge. And now I've forgotten what your question was, Karindy.
Well, so I was talking about anesthesia and detox and how you basically are prepping these bodies like before doing an intervention like this, because it can be so, we're already talking about a nervous system that has been dysregulated, that is not in a balanced place. And then we're putting it under this giant medication that changes the heart, changes everything.
Yep.
But you were supporting the body. So I just want to speak to that. If anyone's hearing this and they suddenly are panicking about this thought, it's a balanced approach in how you utilize these interventions.
Yes. And maybe, hopefully, why some of my patients do so well after tonsillectomy is just that. Like we've already tried to kill the bacteria as much as possible, heal the gut as much as possible. We've done everything. We've done a lot of glutathione, opening up the detox pathways, antioxidants, anti-inflammatories. So then, yes, when it's time to do the tonsillectomy, they're ready to go. And they tend to do really well afterwards. The other thing is when you, again, speaking to what you do, is just mouth all of it, right? Where it's all connected. And the brain's right here. It's all connected. So when you are even thinking about dental work, I'm often going, okay, what herbs, antibiotics, supplements do we need to do to prepare you for when you lose a tooth, for when you're going to do dental work, when you're going to do palate expanders, all that stuff, because I see flares. Woo, we need some patience on this podcast, so we can talk about some stories.
I know. Let's talk about that. What about loose teeth and PANDAS? Talk about how those flares can be triggered.
Yeah. So definitely, I mean, all of this is your body will make an immune response to losing a tooth. And these are normal. Like, you're supposed to make these immune responses, but when you already are in hyperdrive, when you're already living at a 9, it's not too hard to get to a 10. Right. And so, we see all of the sinus, nasal congestion, tonsil, adenoid hypertrophy, dental work of any kind, from Invisalign to braces to losing a tooth, all of that, all the shifting is going to create this immune response, and we see the flares.
So let's talk about what we keep saying, flares, and you and I are around this, so we think of it that way. Someone listening might think, well, I thought we treated it. So we found out that there was a strep. There was some type of inflammatory insult, and then we have treated it, maybe with antibiotics. Actually, let's talk about that. What the treatments are you do? And then it seems like it should be cured. Let's talk about, is it cured? And then what is this that we're mentioning in regards to flares?
Yeah, no, great question. And really, this is where we do need more research, because there are kids that just are predisposed. Genetically, they have something within their immune system or their body that is going to overreact to a normal viral or bacterial insult. And so we call those flares. So we treat that and they're good. Right. And then they get sick. And I always tell my patients, you're going to get sick again. They're going to flare. And then they flare. And then we treat it. And then we're good. And then they flare. So I think this would be a good point to say too, early diagnosis. So if you have lived your life in a flare because no one knew it was PANDAS, and so you have been dealing with the anxiety and the OCD and the restricted eating and the tics and the bedwetting for 5-10 years. People ask me all the time, is this going to cause permanent brain damage? No, there's no real good evidence that it causes brain damage as you would think of, like a scar, but you have now lived your life an anxious or depressed or OCD person. And it is so much harder to untrain the brain when you have been living your life like this. Not that I don't still have some great success stories, but when you get them on like week 1, oh my gosh, it's so magical. I'm like, here, I look like a miracle worker. All I did was call in some augmentin. I mean, so they're like, oh my gosh, like all of it melted away. But these are the kids where I'm like, okay, we're going to flare. You have now shown me to have PANDAS or PANS. And so that's kind of the journey. But we know what we're up against. So we're not going to flare for 10 years. We're going to flare for a few weeks, and then we're going to be good. And we're going to flare for a few weeks, and then we're going to be good. And that's terrible. And that's what I was speaking to. We need more research. Like, what? Yes. Really fix the immune system. How do we really get to the root of what is causing this? And that is still to be seen, but at least there's so much we can do to give these kids normal lives while we're waiting for research to catch up.
So let's talk about some of the new interventions that you're utilizing. And I think of, you just said, like, let's change the immune system itself. Like, I think of IVIG. Talk about some of these interventions. We've got the antibiotics, but what else are you using in these cases?
Yeah, for sure. So I do tend to go to antibiotics first if I know what I'm up against, like a strep or a mycoplasma. I'm like, okay, let's kill it. It works. Yeah. Who doesn't want it to work? It works. Right. But then I do a lot of supplements. We want to support the immune system. We want to help the detox pathways be open so that the flares are hopefully milder when they do come around. But you're going to have patients that don't respond. So I have patients that we do as best we can. And either the flares are all the time, because these kids, unfortunately, people get sick all the time, or we're never really back to baseline. So we made headway, but we're never quite where we need to be. So then we can do IVIG, which truly is kind of like an immune resetter.
What does IVIG stand for?
Oh yeah, intravenous immunoglobulin.
There we go.
I know. IV.
Sounds glamorous.
Yes. It's so glamorous. It's not. It's horrible. It is a protein. It makes you feel like you have the flu. It's like I'm intentionally making these poor kids feel sick for a few days to reset the immune system. But keep in mind, so especially if people are listening going, oh, well, I just need to go out and get IVIG. No, if that's the only thing you did before you killed the strep, before you prepared the immune system, a couple good days maybe, and then you're right back in it. And that's just such a waste because it doesn't feel good to get IVIG. So you got to prepare the body, and not everybody most people with PANDAS don't need IVIG, but if you are the one that needs it, it can be a really good tool to have for the more refractory kids.
So what about people that, because I see this like on Instagram, that they'll say, and I understand they don't want to use antibiotics because of the gut, because we are killing off, beneficial guys that are in the gut. And so they will talk about herbs and that it's actually a parasite issue. Can you speak to that?
Yes, absolutely. Yeah, no. And parasites are kind of becoming my newest favorite topic. Just finished a parasite cleanse.
Yay.
So yes, no, I think you really do have to dig pretty deeply into what else could be going on and how else could we treat it besides antibiotics. For your classic PANDAS, strep mediated, in my humble opinion, antibiotics are the way to go. There are herbs out there that can kill strep. I haven't had tons of success with them. I have patients that we've dabbled in the herbs for that specifically. I'm open to that, but I feel like for something really basically straightforward like strep, I'm like, just let's do the antibiotics. We'll clean up the gut on the back end. I'm really good at cleaning up the gut. But for other things, if we're dealing with mold, if we're dealing with Lyme, if we're dealing with other bacteria that are a little bit more nebulous or I can't put my finger on it, I use herbs a lot. So I do like herbs. I find them to be very helpful. But yeah, got to do the testing. You got to really know what you're up against.
What about ozone? Can you utilize ozone to kill any of these things?
Yeah, so we don't have ozone in our practice. We do have another practice that I'm sure you know and love that we refer to for ozone.
Yes.
So yeah, I do. Ozone has bactericidal properties, and that, I definitely support my patients when they want to go and get ozone. I just don't have it at all in one piece.
Don't have it yet. Yeah. I think it's so fabulous. Okay. Yeah. So I would love to know what made you create this course. Like, why did you go, I have all of this knowledge. You're helping families regularly, as you said, hourly, like all day long.
Yeah.
But you can only reach so many people. So what made you create this course?
That was basically it. I get a lot of phone calls. I have families that can't afford to come see me, or they're out of state. Yeah. So I thought, okay, I need to get something together. I kind of thought maybe I would make a handout.
Right.
And I didn't know how I was going to kind of get the information out there. And then I was like, some little birdies told me to make a course, and I was like, okay, let me see how this would pan out, and I'll get it. Pandas. Anyways, pan out.
Yes.
So I just thought I really need to have some way to get the education out there to families who maybe it's not PANDAS. Maybe they would listen to it and go, oh, this doesn't even fit. I think my kid has something else. So
let's talk about some of those things that come up. And you do have a quiz. That the PANDAS quiz that is on your website. So guys, if you want to find out a little bit more, if you're not sure, you're like, I think maybe my kid has this, or maybe my nephew has that, you could look it up. And what are the things that you talk about in the quiz that could be issues coming up that aren't actually PANDAS?
Yeah. So other mimickers of PANDAS is going to be Lyme disease, Bartonella, mold. And also I added some autism into the quiz because that is very challenging and common comorbid condition. Like a lot of my patients are also on the spectrum, which again, then you get to this like acuteness, like when did something change if there's always kind of been something wrong. So thankfully we do have some testing out there that can really help us determine what's what, but I've added that in there too. And this is just a quiz. This is just to kind of say, hey, do you fall into any of these buckets? I didn't get into viruses and parasites. Oh my gosh. There's so many living organisms out there that can cause PANS, but just something to kind of go, okay, here's some really big ticket items that you could notice an acute change in your kid. And does any of this fit? And if it fits, then we've got resources, things you can take to your provider or pediatrician if you're out of state. And if you want to, you can come see me.
Yes, guys, I highly recommend that you see Dr. Jones. So what about our environment? I know we have had shared patients where I love the educational side of the information you provide about toxin exposures. Can you speak to pesticides, coloring, all of those things?
Yes. Oh my gosh. And finally, we're starting to get some legislation about the food
Yes,
dyes.
I know.
But yes, we are covered in toxins. And maybe that will pan out that's why we have so much kids with
Right.
PANDAS is we're born sick. I mean, they've done
Yep.
studies now. Kids are born with plastics in their brain. Well, that's not normal. Last I checked, not normal. So
No.
we are bombarded with pesticides, herbicides, air pollution, plastics. It's everywhere. So yes, so we can do testing for these environmental toxins and determine if you need diet changes, if we need to be, everybody should be eating organic in my humble opinion, but
Right.
if you really need some stronger diet changes like no gluten, no dairy, I don't tend to make blanket statements.
Yeah.
Like everybody go gluten free. Maybe that's a good idea, but I tend to do the testing to go, okay, who needs what? Especially when you're dealing with a kid with restricted
Yes.
eating. I'm like, you'll die if you don't eat gluten sometimes. So,
Right.
We got to do everything within reason, but I do a lot of testing to kind of see what toxins are building up. Same thing with mold toxins, which are very common, but if you're living in a house with mold, you'll have 25% of the population will get really sick with that.
Which is so hard. In Houston, we have a lot of mold. We just have a lot. It is a very humid place to live. So it is something that you see very regularly. What would you say are the top issues? I know we talked about omegas are off. I mean, what about like vitamin D? What about B vitamins? What are these issues that you would say, like, these are the top criminals in my practice of what I see that kids need support in?
Absolutely. I would say I almost never see a kid with normal omegas, and that's even children that are taking omega supplements. We're rarely giving enough. So I see almost ubiquitously low omega-3 levels, which is fish oil. And then
wait, can you talk about, I know a lot of people don't have, and then we'll go back to the other criminals that are on that list, but fish oil versus cod liver oil versus algae versus, can you speak to that?
Yeah, for sure. So basically, you're really wanting to get the omega-3s in, and you want to minimize omega-6s, which are in like seed oils that are in all of our bagged chips. So you want to minimize your 6s and you want to increase your 3s. We need both, but we're in America getting way too much 6s and not enough 3s. So we got to balance it out. So if you eat even just veggies, you're going to be getting plenty of omega-6s. You don't need all the extra stuff that comes in the bags.
Right.
So, and then you need a ton of omega-3s to make it balanced out.
I know a lot of people don't like fish oil, and because it can be rancid, it can be that, it's been denatured, things like that. So I know, yes, we need the omega-3s, but we need quality omega-3s.
You need the quality. Absolutely. Great point. So, and they do have plant-based. There's plenty of omega-3s that are plant-based. So I'm not a huge stickler on where you're getting plant-based or fish-based, how you're getting it, but you want a quality product. And so typically I will have like a full script link where I will put in my quality products that I've kind of vetted, and I know that the companies are good, and well, I hope.
Right.
I've done my research as best as I can without working with the company.
Yes.
To say that these are probably quality products. And I know I say fish oil a lot, but it can be a plant-based or a different type of omega-3s.
So then the other, you would say, so the omega-3s tend to be low. What about minerals, other vitamins, other issues?
Yeah, really common to have low zinc. We definitely do not think about zinc enough in Western medicine. So zinc is low a lot, and zinc is really important for the nervous system, and you want a really good zinc and copper balance. So zinc is really important. I also see a lot of low B12. So B vitamins, I'd say in general, zinc and omega-3s are very, very common. Now, everyone's also low in vitamin D. So that's another one. Although I would say from a pure neuroinflammatory standpoint, I give everybody vitamin D when they're low, but I think the other 3 may be a little bit higher on my list of like causing problems.
What about in my world, seeing sleep disorder breathing? Well, usually if we have enlarged tonsils, things like that, we tend to have anemia. Now, part of it can be also the gut is not absorbing things. And so could be that. What is your take in regards to anemia, oxygenation in the body, and that as being just iron in general, even? What would you say about, and you test for ferritin, which I love.
I always test ferritin. I was just going to say, it's not even anemia. It's the ferritin. It's the stores. Your sleep is just as crappy if you have low iron stores as if you're actually anemic. So I check ferritin all the time, and I usually want it at least 20, if not 40 or higher. So normal ranges when you're doing regular blood work, say ferritin over like 7 or 10 is usually okay. And I'm like, we don't listen to that.
Right.
We want it higher than that. So yeah, I do a ton of I check all of these. I check on everybody. If you're coming in, you're going to get blood work. Okay. To people that are listening, that is just going to happen.
You're not going to walk out without a prick. It is happening. Yes.
It is happening. Yeah. The ferritin we check on everybody. And it is really interesting how ferritin is tied to sleep. I mean, this is getting off on a tangent, but if you're restlessly sleeping, I can almost guarantee you're low in iron.
Wow. You run sleep studies more than any other neurologist that I work with.
Okay.
And it could be because if I'm sending them to you, I'm like, they need a sleep study, please. And you're already working on that. Why is it that you are assessing sleep studies so much? And I'm not saying other neurologists are not, but it is very high on your list of priorities to take a look at. Why would you say that is?
Sleep's our foundation. I mean, it is coming out now that we should be prioritizing 8 hours for an adult, more for kids, but 6 to 8 hours of sleep at night, more than even exercise. Like, I mean, this is just coming out that if you are not getting your sleep, you are not having the ability for your lymphatics in your brain, the drainage system of the brain isn't going to work. That happens while you're sleeping. So, sleep is just critical. So, and sleep issues are so common in kids for all the reasons. It doesn't have to be PANDAS. There's so many reasons. They have big tonsils or they have low vitamins.
Screens.
Oh my gosh. Electricity is the worst thing that ever happened for our sleep.
Talk about it. Tell us about it.
Yeah. The light, it directly tells our brains it's day.
Yeah.
How are we supposed to go to sleep? So we have to turn off the light. I mean, then it's cultural, right? So we are in America where we keep all the lights on and we watch our TVs to fall asleep. And I get it. I have kids too. I get it.
Yeah.
So not on my high horse here. I'm just saying that these are all the problems that are impacting our ability to fall asleep at night and get that good quality sleep. So so somebody's coming in, we're going to talk about sleep hygiene.
Yep.
If it's an easy fix, we're going to talk about tonsils. I mean, there's so many things, but I do a lot of sleep studies to make sure we're treating everything.
And when we are collaborating over them, I will often help with if it's an obstructive sleep apnea. But can you talk about essential sleep apnea and what that looks like as far as, because that is going to be more in your terrain for treatment than the obstructive side.
Yeah.
For me.
So
anyways.
A lot of times if you fix the obstructive sleep apnea, the central sleep apnea does get better. But the difference for the people that are listening, so obstructive is airway. So you lay flat, your airway gets floppy or you have big honking tonsils and everything just smashes together and you physically can't get the air in. Central's coming from the brain. Central is the signal that's pulsing every however many seconds. Breathe. It's just the signal. And so if you have terrible obstructive sleep apnea, that will often impede the signal. And so things in the brain aren't quite working right. You're not getting good oxygen to your brain. And so you can have more central sleep apnea. But there are people that have just central sleep apnea for a variety of genetic or structural reasons. So if I just see central sleep apnea, then you better bet I'm getting you in an MRI scanner and we're going to figure out what's going on.
And that makes such a tremendous difference. If, you can spin your wheels watching, reading all the airway stuff, all the myo stuff, trying to do tongue ties and all these things because sleep is an issue. And it can be, there was, a little tumor on this gland or something in the brain that has run amok. But it's been really subclinical, and the only issue is the sleep, which is a big one. But it's just so important that we are looking at it objectively and getting that information. So it matters so much. What are your thoughts on, and we'll just talk about in general, CPAP versus expansion versus versus the ALF, these types of things, because I know you see them. Yes.
I'm loving the ALF more and more and more. I can't tell you how many PANDAS patients I've had that went and got the ALF and were like, whoa, like it really reduces neuroinflammation when you can get everything like aligned, and to see that, and I can literally track it with blood work. That's crazy.
That's incredible.
So that's really cool. Now, in a perfect world, we could all afford ALFs.
Yes.
And I think that like those types of like what you do and just really like naturally fixing things and working on things structurally without having to do palate expanders and big screws up into the palate and CPAPs blowing air into you. Yes. But I like oxygen.
Right. We've got priorities.
Yes. So if I have a family that doesn't have, don't have the resources to go and get an ALF or do other things, or let's be honest, the bandwidth, right? This is a lot. When you're dealing with a kid with neuroinflammation, sometimes you're like, I just need them to sleep, and CPAP does the trick. So oxygen's good. So I definitely do a lot of CPAP in kids, but I do talk about it. I'm like, you could go see this particular ENT, or you could go see Karindy, or you could go over here to our wonderful dentists that do ALF, and if they're open to it.
Right. And I would say too, with the ALF, it is an amplifier. We do tend to say it's like a megaphone for the nervous system. So sometimes in a child that has PANDAS, we'll actually see they seem worse initially, and detox, like all of a sudden they're like, they were draining. There was a lot that was just coming out. There's a lot that is activating and clearing. So it's not even uncommon for things to get a little worse initially before they get better. So it is a little bit of saying, buckle up.
Yeah,
we're in for this, but then there's a goal for us to get better overall and address those root causes.
And it's the same kind of thing with like IVIG. I hear that all the time. Like, oh my gosh, like they did terrible for a couple of days, but then everything settled out. I'm like, we just have to be prepared for the ups and downs of neuroinflammation. And when you detox, it can be bumpy.
Right. What about stem cells? Like people saying, we've got PANDAS, let's just change out our stem cells. What are your thoughts on that?
So that is oh my gosh, again, another thing. I'm like, parasites and stem cells are like my 2025 jam.
There we go.
I think I'm going to be loving stem cells more and more over the next 5 years of my practice. And that's probably something I'll be offering at All in One Piece hopefully in the near future. I think that still holds that you want to treat any known bug. You want to treat the mold. You want to treat the parasite. You want to get as much as you can to kind of that root cause and heal the gut before you start to spend, because it's expensive.
Yeah,
you're talking somewhere between $7,000 and $20,000 for stem cells.
Just to start.
Yeah. And you need more than one round.
Yeah.
So you're looking at multi-tens of thousands of dollars to do stem cells.
Right.
But if you have prepared the patient, I really have seen some exciting stuff lately with stem cells. So I'm starting to get to this point in my career where I'm like, okay, because I think in the beginning, doctors were just learning about stem cells, like how much, what types, like all these questions out there about stem cells that I didn't have the answers to. And I don't think a lot of people had the answers to. And, Duke was doing studies, MD Anderson was doing studies, and it's really cool to see the orthopedic improvement, like that sect of medicine that's really taken off with stem cells. But the nervous system has been a little bit harder to crack into and figure it out, but we're getting there. So stay tuned on the stem cells, but I'm kind of excited about them.
So what is your hope for research over the next 5 years? I mean, you're seeing all these things and you're an innovator, you're a creator, you're thinking about it differently. Where do you hope to see research breakthroughs soon?
Yeah, I would really love to see more research in how toxins are affecting us. And that sounds crazy because of course they are, but we don't know how. Until we know how, Western medicine is not going to accept it. And
Right.
so
Right.
I'm like, we need more research into, like, even right now, they're like, oh, well, microplastics aren't good for us, but we don't know how much microplastics are impacting us. Okay, so we need this research.
I hope you're watching this on YouTube because Dr. Jones has the best expressions.
So we need that. And then I'm thinking as we learn more in that and how it's impacting the immune system, we're going to start to get to the root of some of these autism, PANDAS, to a certain degree. And I'm getting a little controversial here, but PANDAS can be just another wing of autism in so many cases. It's all just brain inflammation.
Right.
And so, I mean, again, getting into the weeds, but I would love to see more research on how these toxins are truly impacting us and how we can fix it, reverse it. Like, if we can fix the immune system, we can fix this, right? We can prevent it.
Yes, guys. Okay, so immune system, let's support it. I love that we're hearing from a neurologist about immune system support and really how we can change our body. We can change what is happening when we have that in place. So what would be the things that you recommend someone do right now? Maybe they don't have PANDAS or they don't have someone with that they're experiencing, but how can we support our immune system from a pediatric neurologist's perspective? What should we be doing?
Yeah, absolutely. I would say we all need some form of glutathione. So in adults, we'll often do NAC, N-acetylcysteine, which turns into glutathione. So that's just a pill you can take. I take it every day. So some kind of glutathione is super important. I like turmeric. It's a great natural anti-inflammatory, and some kind of omega-3s, fish oil or plant-based omegas. I think that's just like such a great foundation for who does it hurt? Nobody. Everybody take it.
Right.
Please consult your physician before you take any supplement.
There we go. This is not medical advice.
This is not medical advice.
We've got a disclaimer at the beginning and the end. Just so you know.
But honestly, I think that is going to be, and then if you really want to know a lot of these answers, you got to go do the testing, right? I'm not going to say everybody take B12. I'm not going to say everybody take D. Right. Vitamins. Somebody out there could overdose on and have too much. I haven't seen it yet, but in theory, there could be people out there with too much vitamins. I've never seen someone with too much omega-3s. Glutathione's amazing. Turmeric's a spice. I mean, these things are pretty easy and they're very healthy for us. And then you got to do all the other stuff. You got to get your 8 hours of sleep. You got to get some strength training and exercise going on. You got to eat organic. You got to think about your nutrition. These are foundations. You got to drink enough water, preferably reverse osmosis, like super clean water, not coming out of the tap.
Yes.
Yeah. There's a lot. It's a lot. It's overwhelming. So I definitely try to take it step by step with my patients too, because they're usually dealing with some sick kids, and
absolutely
it's overwhelming. I get it. Admittedly so overwhelming, but if you just make small steps, a year from now, 5 years from now, think how much healthier you're going to be.
Absolutely. You know, there's that saying, it's like we overestimate how much we can do in like 2 months, but we underestimate how much we can do in 2 years. And it's like, you can really start to change things, even just cell membranes, you know, just the half-life of how everything is shifting and changing over. It's so important that we're just thinking of a long game. So someone is listening and they're now going, I need to see Dr. Jones. What do they do? How do they get in contact with you? Where are you?
Yes. So I am in Houston, Texas, and we have a website, aiopwellness.com. So you can find all about what we do there and me, if you wanted to see me specifically, on that website. And then I think we're going to have a couple links on the bottom for the quiz and the course that I have, and just some more information in case you're not in state or you can't come see me.
So if you're listening on Apple or Spotify, you'll open up the app and you'll scroll down, and in your show notes, you will see the links to connect with Dr. Jones. And I would encourage everyone, if you're a provider, if you're in the airway space, please reach out to Dr. Jones. Like, I want her teaching people at dental seminars, at biohacking seminars, conventions, whatever it is, because this information, we need more providers that understand this holistic approach, understand the brain, can really diagnose and provide pharmacological interventions when they're needed, because when they're needed, it is so important. And I am so grateful for your expertise in that area. So I really encourage everyone to just know Dr. Jones. And she's fun, guys. How often do we see neurologists that are fun? She's got a great sense of humor. So there we go. I love neurologists, guys. Thank you so much for loving the brain. I'm just saying, she's my favorite. If anyone has any questions, please reach out. You'll see the link. All in one piece is her amazing clinic, which, like I said, offers the foot detox, sauna, the flow presso, which is beautiful lymphatic drainage for the whole body and very calming for the nervous system. So all of these things here in her clinic in Houston. So thank you so much, Dr. Jones, for your time and your expertise and your love. You love your patients. And you really think about how to help them, whether it's seizures or, an inflammatory response. You are there in that moment with them. And I'm so grateful for that. So
thank you for having me. And I love you too.
So everyone, please like, share, and rate this podcast. It really helps to get the information out so we can get all of these families that want to know, how can I help my child that has PANDAS? We can really help them with this information. So please get this out and share it with someone, and we're going to make a difference. I hope you have enjoyed this episode of the Myohacker Podcast. Remember, small changes can make big impacts on our overall health and well-being. If you enjoyed this episode, please take a moment to rate and review wherever you get your podcasts. This way, more families will learn about this important information and we can make a bigger impact. Head on over to myohackerslp.com for in-depth resources and guides. You can also join me on Instagram at myohackerslp for bonus content and demos. And if you have questions or topic suggestions for future episodes, send me a message. I would love to hear from you. Until next time, let's biohack myofunctional health as myohackers who change the world through intentional action and connection and breathing. Quick disclaimer reminder, the content shared in this podcast is for informational and entertainment purposes only.